Continuing with the strengthening phase here. This is E21, wrist 3-way with weight or the TheraBand. So first, you're just going to, this is all the wrists. You're going to do some of the flexors. You're just stepping on the TheraBand. If you notice, the wrist isn't turning at all, straight up and down. There's really pinching there at the end. So that's wrist flexion. Then you're just going to do some hammers right here. So the thumb's on top. And then we'll roll the wrist over. You notice he's just resting the forearm on his thigh there. Elbows bent. He's just doing some wrist extension. So there's 3 positions. There's wrist flexion. There's the hammer with the wrist. And then there's wrist extension. That's E21. Next we'll do E22, which is the biceps 3-way. So 3-way as in there's 3 positions. So this one he's just doing a regular curl, palms up, just pinching at the top, contracting that muscle. And then we'll do the hammer curl, thumbs on top. And again, good posture, nice and slow form, controlled breathing. And then next we'll do the palm down. Same way, the elbow is stuck to the side, it's not coming up, it's not going back, it's not going out. Then next we have the triceps with the TheraBand. Just going to demonstrate with the left. He's just strapping the TheraBand onto something. Yep, elbow's kind of at a 90-degree angle, a little lower. Yeah. And just straighten the arm out. Really good pinch for working on that back of the arm there. Controlled breathing, good posture with that. Next we have the forearm pronation and supination. He's got both hands together. We're doing supination here. We kind of key this like having a bowl of soup in your hand. That's why we kind of note that it's supination. Next, we're going to cross the arms there. Just kind of pulling away from each other. This will be pronation. We're just working on those forearm muscles. Next, we have ulnar and radial deviation using the stick, cane, whatever you have at your office. At home, you can tell the patient to use a hammer, something that's kind of heavier at the end. So he's kind of at the end of the cane, so most of the weight's at the top there. You just thumb down, thumb up. And, rotate that so the weight's at the bottom. Going back there. So right there is ulnar deviation. And radials with the thumb kind of makes an R. That's how we kind of note that. And that's ulnar and radial deviation using a stick or a cane. Again, telling the patient to use a hammer or a pod at home. Next, we have the wall push-up using the physio ball. This is E26. I'm just going to stand to this side here. Again, ball is right in front of their chest. Feet are close together. You're just going to come in and hold for a few seconds, 2-3 seconds. Push yourself out. Body's in a straight line to make it harder. You're just going to ask the patient to scoot their feet out further, so it's more of an angle. Yep, and that is the physio ball wall push-up. And lastly, I'll just kind of demonstrate myself. If you want to rotate the camera over this way, kind of slide the chair over. These are this is E27, the fine motor skills. In your office, you might have some screwdrivers, some sockets, or something. In this video, we're just going to use some paper clips. We're just going to pinch the thumb, finger together, have them grab the paper clip, kind of drop it in the container. We'll go on down the list with the other fingers. Just dropping in using the pinky. And you can kind of go back through them. And you just have them pick it back out. Just using all the fingers, fingertips. with sockets. Just kind of come up with something creative. We're using all the fingers there. Just a challenge to really fine motor skills. And that concludes E27 in the strengthening phase of the elbow and wrist.